Hey there, friends. It's Pharmacist Michael. Have you ever stood in front of your doctor, completely overwhelmed, after hearing the words, "We're gonna start you on either Ozempic or Jardiance"? You nod politely, but inside you're thinking, what's the difference? And which one is better for me? Well, today, we're breaking it all down. Ozempic versus Jardiance. So you can make the best decision with your healthcare provider, not just nod along. Remember, the more you know about the medications you take and the alternatives, the better. So here we go. Let's start with the basics. Ozempic is a GLP-1 receptor agonist. That means it mimics a natural gut hormone called GLP-1, which helps regulate blood sugar, slow digestion, and suppress appetite. Jardiance, on the other hand, is an SGLT2 inhibitor. This one works in your kidneys, helping your body flush out extra sugar through your urine. That's right, you literally pee out the sugar. Now, both lower blood sugar, but in very different ways. We'll cover this in more detail a little later on. Here's where it gets interesting. Both Ozempic and Jardiance are approved for type 2 diabetes, but they each have some added superpowers. Jardiance has strong heart and kidney benefits. It's approved to reduce the risk of cardiovascular death and hospitalization for heart failure, even in people without diabetes. Ozempic is a rock star for weight loss, even leading to the newer Wegovy version, which is FDA approved for obesity. So if your top priority is heart failure or kidney disease, Jardiance might win. Weight loss and appetite control? Ozempic could be your pick. All right, let's put Ozempic and Jardiance head to head, because no medication is all upside. Both have major benefits, but also some risks that most patients don't hear enough about. And my job is to give you as much information about your medications as possible. So let's start with Ozempic. Ozempic pros is highly effective at lowering A1C. Many people see their blood sugar drop by 1 to 1.5 points. It often leads to substantial weight loss. Some patients lose 10 to 15 pounds or more. It's a once-weekly injection, which a lot of folks find more convenient than daily pills. And it has cardiovascular benefits. It can help reduce the risk of heart attack and stroke in people with type 2 diabetes and established heart disease. Sounds pretty great, right? But now let's talk about the other side of the coin, Ozempic cons. Gastrointestinal side effects are very common, especially when you're first starting. You might experience nausea, vomiting, constipation, diarrhea, or just a general feeling of stomach upset. Some people find these symptoms mild and manageable, while others stop the drug entirely because of it. But here's something more serious: gastroparesis. This is a condition where your stomach empties more slowly than it should, and for some people, Ozempic can actually trigger or worsen this. If you notice early fullness, bloating, or vomiting hours after eating, it might be more than just nausea. That's something you must bring up with your doctor. Another thing that's not often talked about: if you stop Ozempic, you'll likely regain the weight you lost. That's right. Multiple studies show that most patients regain a significant amount, sometimes all, of the lost weight within months of stopping the medication. Why? Because the appetite suppression goes away, and if you haven't made major sustainable changes to how you eat and move, your old patterns often return. So while Ozempic can kickstart your journey, it's not a magic bullet. It works while you take it, and most people need to stay on it long term to keep the benefits. And let's not forget, it's an injection, which some people aren't comfortable with, and it's expensive. especially without insurance coverage. Although rare, there is a black box warning for thyroid C-cell tumors seen in animal studies. We haven't seen this in humans, but it's a precaution, especially if you or your family have a history of medullary thyroid cancer or MEN2. Now let's shift to Jardiance. What are the pros? Well, there's no needles. It helps lower blood sugar effectively. It's cardioprotective and renoprotective. It's approved to reduce risk of death and hospitalization in people with heart failure and chronic kidney disease. It comes with mild weight loss, usually 5 to 7 pounds, and it also helps lower blood pressure, which is a nice bonus for many patients. What are the cons? Well, because it works through the kidneys, flushing out sugar, you'll likely pee more. A lot more. That sugary urine can also increase the risk of urinary tract infections and genital yeast infections, especially in women. There's also a rare risk of something called euglycemic diabetic ketoacidosis, a potentially serious condition that can happen even if your blood sugar isn't very high. This is more common if you're following a very low-carb diet or fasting. Jardiance may cause dehydration, dizziness, or lightheadedness, especially in older adults or people taking diuretics. And it may cause a slight increase in LDL cholesterol in some people. So, both medications offer some major benefits, but they also come with real side effects that deserve a serious conversation with your provider. Whether you're considering Ozempic or Jardiance, the right choice isn't just about lowering your blood sugar. It's about your overall goals: weight, heart health, kidneys, tolerance, and long-term sustainability. Now here's something a lot of people don't realize. You can actually take both Ozempic and Jardiance together. And in the right situation, this combo can be a total game changer. Let me explain. These medications work through completely different pathways in the body, which is why they can complement each other so well. Ozempic targets the gut, pancreas, and brain. It mimics a natural hormone called GLP-1 to stimulate insulin when you need it, reduce excess glucose output from the liver, slow down stomach emptying, and most importantly for many people, curb appetite and reduce cravings. Jardiance, on the other hand, goes after sugar in your kidneys. It blocks a protein called SGLT2, which normally helps your body reabsorb glucose from your urine. When you block that, like I said earlier, you literally pee out the sugar. Plus, it's been proven to protect your heart and kidneys, even in patients without diabetes. So, when used together, these two meds attack type 2 diabetes from multiple angles. Ozempic lowers appetite, boosts insulin, and improves glucose control, and Jardiance flushes out sugar, drops blood pressure, and protects vital organs. I'd like to call it a metabolic 1-2 punch. They work better together than either one does alone for some people. I had a patient, let's call her Maria. She was in her mid-50s, had type 2 diabetes for about 10 years, and also had high blood pressure and early signs of kidney trouble. She started with Ozempic, and it helped bring down her A1C. But she hit a plateau. She felt sluggish, and her weight loss had stalled. Her doctor added Jardiance. Within 3 months, her A1C dropped another full point. She lost another 6 pounds. Her creatinine stabilized, and her blood pressure improved. Now again, this isn't magic. It won't work like that for everyone. But for Maria, the combo brought her back into balance. But here's the caveat. This combo isn't for everybody. You and your provider need to consider insurance coverage and cost. These meds are pricey without good coverage. Side effect tolerance. Stacking meds can increase nausea, dehydration, or risk of low blood pressure. And other health conditions, like a history of pancreatitis, chronic UTIs, or kidney disease stage. So if you're on other diabetes meds like insulin, sulfonylureas, or metformin, your doctor might adjust your doses or even stop one to avoid complications. And of course, always stay hydrated, especially if you're on Jardiance, since you're losing more fluid through the urine. Let's also talk about who should steer clear of these meds, or use with caution. Avoid Ozempic if you have a personal or family history of medullary thyroid cancer, you've had pancreatitis, or if you're extremely sensitive to GI upset. And be cautious with Jardiance if you have frequent urinary tract infections or yeast infections, you're dehydrated, older, or on diuretics, or if you have advanced kidney disease. And of course, always talk with your healthcare provider about your full health history before starting either one. So, which is better, Ozempic or Jardiance? Honestly, it depends on you. If your main goals are blood sugar control and weight loss, Ozempic might be the better tool. If you've got heart or kidney concerns, Jardiance is hard to beat. And if you need both, the combo may be exactly what your body needs. The most important thing is to understand your options and partner with your provider. You don't have to feel overwhelmed. You get to make informed choices about your health. I'm Pharmacist Michael. Thanks for watching. If you found this helpful, hit that like button, subscribe, and share it with someone you love. And as always, be happy, be healthy, and I'll see you in the next video.